Welcome to IntelliDocs. This video will explain how to do Computerized Provider Order Entry, or CPOE, for medication orders and maintain the patient's medication list. In IntelliDocs, CPOE for medications is just another way of saying writing a prescription. To create a new script, click the Meds button on the toolbar or the Patient Notes bar. Remember, the IntelliDocs toolbar can be customized according to your job duties and your preferences, so your Meds button may be in a different position than the one shown here. IntelliDocs will display the patient's meds list with active medication shown in green, prescriptions that have run out or lapsed shown in yellow, and prescriptions that were stopped highlighted in gray. Licensed personnel can write scripts by clicking the New Rx button at the bottom right corner of the Meds screen. If you've been using IntelliDocs for a while, you've probably saved a list of the scripts you write most often to your MyRx list, and you've probably used the Quick Sig Aid feature to quickly fill in the details for prescriptions. But for now, let's create a medication order or script from scratch. The Active Rx tab shows a list of all medications that your system manager has marked active for your practice, and the All Rx tab shows the complete drug list. If you haven't saved any medications to your MyRx list, the Active Rx tab will be selected by default. The easiest way to find the drug you want is to just start typing its name in the drug field over here at the left side of the screen. Any medications that match what you typed will be shown at the right side of the screen. If there are multiple forms and/or strengths of the drug available, each will be shown on a separate line. Just double-click the one that you want. Now you're ready to enter numbers for the day supply, refills, and dispense fields. You can either type a number directly into a field or use the up and down arrow buttons at the right side of each field. The up and down arrow buttons beside the day supply field help you enter values for typical prescription lengths. The first time you click the up arrow, the day supply will change to 30. Clicking the up arrow again will change the number to 45, then 60, and so on. Or you can type a specific number right into the day supply field. The refills field defaults to 0, but you can specify how many refills are allowed by clicking the up arrow. Click in the dispense field and type the number of tablets or other units that should be dispensed. The SIG field is where you type the instructions to the patient, such as take 1 tablet by mouth once a day. Use the Allow Generic checkbox to indicate whether or not it's okay for the pharmacist to substitute generics for brand name drugs. If you need to prescribe more than one drug for the patient, click the Accept button near the bottom right corner of the window and repeat the process to select another drug and enter details for the script. We'll cover how to e-prescribe or send the prescription to the pharmacy electronically in another video. For now, let's just print the prescription by clicking the Print button to send the script to your default prescription printer. The patient's meds list will reappear with the new medication on it. Once you've created a prescription, the only change you can make to it is to modify the ending date if the patient uses less or more of the drug than planned. But if the patient stops taking the drug altogether, perhaps because of a reaction, you can mark the drug as stopped in IntelliDocs. You can also stop a drug if it was prescribed in error. Let's say we selected the wrong dosage of Lipitor. We'll mark the original script as stopped, then create a new prescription for the correct dosage of Lipitor. Click Lipitor on the list, then click the Stop button near the bottom left corner of the screen. Click New Rx and create a new script for Lipitor 20 mg tablets. We'll use the same settings for this script as we did previously. A 30-day supply, 1 refill, dispense 30 tablets, patient instructions of take 1 tablet by mouth once a day, and generics are allowed. Then we'll print the new prescription. When the meds list reappears, the new active script for Lipitor will be on it. If you have any questions about creating medication orders in IntelliDocs, please send us email at support@busynet.com or give us a call at area code 918-858-4440, voicemail option number 2.